In cross-sectional descriptive studies, the researchers aim to estimate the prevalence of a health condition in a target population, and so they are also called as prevalence studies. In this context, the health condition of interest is known as the outcome. As the term cross-sectional suggests, all the necessary information is collected from the study participants at a single time point and no follow-up is done. To conduct a cross sectional descriptive study, the researchers first define the target population. Then, they recruit a representative study sample from the target population using an appropriate sampling technique. After recruitment, they evaluate the study sample for the outcome using a standard, reliable, and valid method. After completing the study, the researchers report the findings in the form of frequency, percentage, and 95% confidence interval. Prevalence of the outcome is calculated using the formula number of study participants with the outcome divided by total number of study participants multiplied by 100. The 95% confidence interval can be calculated by entering these values in freely available online calculators. Now, consider a study in which a group of researchers wanted to estimate the prevalence of depression in patients with psoriasis. They recruited 150 patients with psoriasis from the dermatology outpatient department using consecutive sampling. After obtaining demographic and clinical information, they administered Patient Health Questionnaire 9 (PHQ 9) to all the study participants. They found that 30 participants scored above the cutoff score of 10 on PHQ 9. They calculated the prevalence using the formula as 30 divided by 150 multiplied by 100 is equal to 20 percentage. The 95% confidence interval was calculated using an online tool as 13.9 to 27.3 percentage. In this study, the key elements can be summarized as target population, patients with psoriasis; outcome, prevalence of depression; sampling strategy, consecutive sampling; and study tool, Patient Health Questionnaire 9. Moving on, consider another study in which a group of researchers wanted to estimate the prevalence of medication non-adherence in patients with type 2 diabetes mellitus. They recruited 200 consecutive patients with type 2 diabetes mellitus from the diabetic clinic of a tertiary care hospital. They administered the medication adherence rating scale and found that 75 patients scored below the cutoff score of 6. They calculated prevalence using the above formula as 75 divided by 200 multiplied by 100 is equal to 37.5 percentage. The 95% confidence interval was calculated using an online tool as 30.8 to 44.6 percentage. In this study, the key elements can be summarized as target population, patients with type 2 diabetes mellitus; outcome, prevalence of medication non-adherence; sampling strategy, consecutive sampling; and study tool, medication adherence rating scale. Finally, consider another study in which a group of researchers wanted to estimate the prevalence of frailty among elderly residents of old age homes in Pune. They recruited 180 elderly residents using a multi-stage sampling method. After obtaining demographic and clinical information, they administered 5-item physical frailty phenotype tool to the recruited participants. The researchers found that 65 out of the 180 participants scored positive on 3 or more items and were considered to have frailty. The prevalence was calculated as 65 divided by 180 multiplied by 100 is equal to 36.1 percentage. The 95% confidence interval was calculated to be 29.1 to 43.6 percentage. In this study, the key elements can be summarized as target population, elderly residents of old age homes; outcome, prevalence of frailty; sampling strategy, multi-stage sampling; and study tool, physical frailty phenotype tool. Thank you.